Good evening, sir.
It's a wonderful opportunity and privilege to be in your midst tonight. And I'm so happy. I welcome each and every one of you. It is an opportunity to share and interact once again. And I trust God that at the end of this interaction, each and every one of us will leave here impacted to the next level. You are welcome once again. Thank you very
Thank
much
you,
for
sir. Can we
this.
see your video, sir? So that they are sure that it's not a robot talking to us.
Okay, okay. Can you see me now?
Not yet. I can see the walls, but can't see your face.
Okay.
So you need to adjust that. Yes, we can. We can see the face.
Okay. Thank you very much.
All right. Thank you so much, sir. Can you just give us your background in a bit? Let's get to meet you.
Um, Judan is my name, and I'm a pharmacist by profession, and I am the owner, the MD, CEO of Savage Pharmacy. It's a community-based pharmacy practice, here in Lagos. So it's a wonderful opportunity to be here with you once again. Thank you very much.
All right. Thank you. So let's get into it. What is pharmacy? I ask this question because there are times that we kind of mix it up with a doctor. Is the pharmacist a doctor, first and foremost?
Um, yes, a pharmacist can be a doctor. A clinical pharmacist who studies and then obtains the PharmD degree is a doctor.
Hmm.
But if you want to distinguish it with a medical practitioner, you refer to them as physicians. So we can call a
Okay.
pharmacy, pharmacists generally are known as chemists or druggists. That's the general term used in describing them. They are health professionals who instruct, advise patients on the safe and effective use of medicines and their possible side effects as they deal with the composition, the effects, the mechanism of action, and then the proper use of drugs. So in summary, the pharmacist is a drug consultant,
Hmm.
and as a drug consultant, he uses his knowledge of the mechanism of action of drugs, to advise on a drug, on how this drug can be used, one, to achieve maximum benefit, and then two, to minimize the side effect of such a drug, and then thirdly, to avoid drug interactions in the course of usage of such drugs. In other words, a pharmacist is a drug consultant.
Okay. Wow, that's deep. So when it comes to understanding drugs, prescription, like you said, side effects, composition, and all that, it is in the place of a pharmacist.
Exactly.
Okay, so a doctor, what is the difference with a doctor now? A doctor, because the
Okay.
doctors usually when we go to the hospitals, a doctor would write out all the prescription and ask you and gives it to you and says you go to the pharmacist to pick it up.
Yeah.
So yeah, what's
A,
the can you help us
a,
explain that?
yes. A physician, we refer to them as physicians.
Okay.
A physician, also called a medical practitioner, a medical doctor, or doctor, as they are popularly called, is a professional who practices medicine, which is concerned with the promoting, maintaining, or restoring health through the study, diagnosis, and prognosis and treatment of diseases. In other words, a doctor or a physician is concerned with the study, diagnosis, prognosis, treatment of diseases, injury, and other physical and mental impairments. A doctor is an expert or a consultant when it comes to the issue of the study and diagnosis of diseases.
Mm. Okay, but after the disease has been diagnosed,
Diagnosed and a prescription written, the prescription is sent to the pharmacist, who is a drug consultant, to interpret the prescription and then dispense the drugs to the patient. Following and as the drugs are dispensed, counsel is given. The patients are counseled on how such drugs should be used properly to to minimize side effects, to maximize their benefit, and then to avoid any form of interaction that may hinder the efficacy or effectiveness of such medication.
Okay, so can a pharmacist alter or what's that word now? Yeah, it could be alter. Can a pharmacist alter prescription by a doctor? Can he
Uh,
adjust?
no, you see, what happens is the doctor, the pharmacist, the nurses, the chemotherapists, physiotherapists, we all work as a team in the hospital setting because no one person knows it all. I just described or defined the distinction between the pharmacist and the doctor. You can see I told you that when it comes to the issue of drugs, the pharmacist is in charge. And then when it comes to diseases, diagnosis, prognosis, etc., the medical doctor is in charge. And if a disease must be treated, you need drugs to treat such. So when prescriptions are written, it goes to the pharmacist, who is a drug consultant, to dispense such drugs. And if in the course of dispensing the drugs, the pharmacist puts his knowledge into play to see if the diseases that has been such drugs have been prescribed for tallies, or if there's any inconsistency in such prescription, all he needs to do is to take note of it and then see a way of referring it to the doctor. On his own, a pharmacist does not have the capacity or the right to change a doctor's prescription. No, you notice it if there's any error or any discrepancy, and then you could make a note, excuse me, or look at the best way possible to get to the doctor to make him see your observation. All,
Okay, and there's some. Okay, you go ahead, sir.
and everything he does is patient focused because the patient is the attention of every health individual,
All
the
right,
doctor,
sir.
the pharmacist, and others. Yeah.
Okay, so we do see cases where people go to pharmacists straight. Some at times they don't even go to doctors, to help out with one ailment or the other. Is it in accordance with your practice? Are you permitted to treat some certain kind of condition or to prescribe without having a doctor's prescription for people when they come to the pharmacist?
Yes. It's generally believed that a very high percentage of the population visit the pharmacists or pharmacies even before getting to the hospitals. Why? Because of the closeness. And that is why the pharmacists, apart from the fact that they are trained as drug consultants or drug experts, they also have a knowledge of diseases. So when somebody comes to a pharmacy, for instance, and then he consults with the pharmacist, he examines what the complaints are. After that, he could make recommendations on what drugs to use. But there are cases where the pharmacist could also refer the patient to the doctor if it goes beyond his scope or beyond what he can handle.
Okay.
Yeah.
All right. Yes, that's beautiful. Because some of these things are things that at times we do and we just think that they might not be legal. But now you're letting us say that is within the ambit of what the pharmacist can do when it comes to some kind of ailment.
Yes.
Okay, now drugs. What are drugs? Let's start with that.
Well, just brief definition so to carry everyone around. They are chemical substances that are formulated to treat ailments, and they could come in various formulations. They could be solid, they could be liquid, they could come in form of capsules. Yes.
Okay, so the word chemical is something that people are trying to run away from because once you hear chemical, the next thing you're thinking is going to cause an injury one way or the other. It's like it has the likelihood of causing an injury to the body, and it has side effects. How true is that?
Of course, there's no doubt about it. Every drug has a side effect, including the simplest drug you can even think of, paracetamol. So it has a side effect. And that is why drugs must not be abused. No matter what drugs you are taking, it is always very advisable you consult your pharmacist. Seek his advice so that whatever drug you are using, you can derive the maximum benefit from such drugs. A situation which is very common and very rampant, and that has contributed majorly to um, most of the problems, the health challenges we have, that has to do with kidney failure, renal failure, or problems with the liver, wrong use of drugs. For instance, somebody.
Sorry, please, can you unmute? I just muted everyone so that we won't get interference. Can you unmute yourself, sir? Oh, sorry. 1 minute. I think I need to ask you to unmute. From Jude. Why am I can find you. Sorry, I'm trying to pick you out. I don't know why I can't. Hold on. Can you? Okay. All right, good. We're good.
Okay.
Follow times. Okay, sir. You can continue.
So as I was saying, um, drugs have side effects. No matter how simple or how uncomplicated such a drug may appear to be, and that is the more reason why it is advisable you seek the consent of your pharmacist, seek his advice on whatever drug you want to use, because he is someone who has spent years to study the composition of such drugs, how such drugs are made, how they interact with the body, how they cause side effects, when you should use them, when you should not use them. So it's advisable, if you must use your drugs, seek their consent, let them have an input. A situation where you just go to any um, shop or any patent medicine store, or to buy drugs, or any drug dealer, because these days, because of the poor regulation, everybody wants to sell drugs. And because of this, it has also led to abuse of such drugs. Because you see, people who are not knowledgeable in drugs selling them. Why? Because they want to make money. And at the end of the day, this constitutes a very dangerous uh, impact, on whoever is using such drugs, especially when it is not coming from an expert. And so the person lacks is not does not benefit from the counseling of a professional who is supposed to advise him on how best to use such drugs. And at the end of the day, the person ends up developing complications, and before you know it, it could result in fatality. Okay,
Mm.
so this is an opportunity to also advise people to ensure that they don't take drugs carelessly. You can imagine a situation where somebody comes and buys a capsule of ampiclos or two capsules of ampiclos. It is very, very dangerous. Please, whoever is listening to me this evening, take this very seriously, because this has accounted to the various health challenges that we have, in some cases leading to early deaths. Why? Because of careless use of these drugs. Antibiotics are very good drugs, they are very effective, but when they are not used correctly, the contrary becomes the case. Instead of being beneficial, they become harmful. Don't forget, the microbes or bacteria or viruses or whatever you are trying to kill using them are also very sensitive, and they don't want to die. So if you don't use these drugs correctly, the normal dose, in terms of duration, and then in terms of frequency, you find out that at the end of the day, you build resistance in your system. And when resistance comes, it's not a good thing to cope with.
Wow, so that is responsible for the at times when you take drugs and this time out, there are times they work, then later the ailment comes back and you use the same drug and you don't see any effect.
Exactly, because the drugs, subdose of such drugs has ended up building resistance. Just as I said, the bacteria, the microbes that you want to kill with such drugs are also very sensitive. As soon as they sense these drugs in your system, they begin to devise means of evading them so that they don't die. It's just like a situation where somebody comes around and begins to shoot in a marketplace. Everybody dies for
Mm.
safety. Everybody wants to go and hide. Nobody wants to die. The same thing happens to this microorganism. They don't want to die. So when they see those drugs coming, they go to hide. And it's been calculated that if these microbes must be exterminated completely, such drugs must be used at certain frequency, maybe twice a day or thrice a day or 4 times a day, depending on the pharmacology or mechanism of action of such drug. And then the duration too. It could be for 5 days, it could be for 1 week, it could be 2 weeks, depending on what you're treating. So if you don't adhere to this, at the end of the day, the microbes become resistant to such drugs because you have fed them with subdose, and then when such drugs come eventually and you are using to treat them, it doesn't have any effect. You see, so because of resistance. So resistance is a very terrible situation, and that is why you see in the manufacturing of drugs, it goes from one class to the other. All they do, because when a particular drug is manufactured and it is used and resistance begins to build, researchers go into action. They begin to see how they can develop new moieties to combat the resistance. And as I'm talking to you now, it's becoming a very dangerous trend. One of the leading pharmaceutical companies in the world announced recently that the rate of abuse of antibiotics is alarming. So it will come to a state where you will not have any moiety to build new antibiotics. And you can imagine what the world will look like. That would be a very dangerous situation where somebody will be sick and there will be no drug to treat him or her. So please, whoever is listening to me tonight, ensure you don't use drugs. If you are one of those that goes to maybe any drug seller to buy a capsule of ampiclos or 2 capsules of ampiclos, or maybe buy drugs just on self-medication, please stop it. It is not advisable. It is not a wise thing to do. Thank you.
Wow. Please, at this point, can we just show some reaction because this is good stuff. It's ignorance kills. It's good that you're hearing it from an expert right now. It's good that we know and we tread with caution. All right, so now this whole thing is a bit scary. So um, people are moving towards organic stuff right now. What's the advantage?
Organic, so fantastic.
Okay.
The world is evolving. We are in an era of technological advancement, or the digital age. You will agree with me that few years ago, typewriter used to be very effective, very functional, and people use it. Olympia was a popular one that time. But today, typewriter is no more. Some years back, if you want to communicate, especially when we were in secondary schools, we want to communicate with our parents, we had to write letter, take this letter to the post office, post it there. It takes weeks or months to get to the destination, depending on the distance. And then to get the response or the reply, it takes another time. But yes, that today, it's gone. And then there's this era where we make use of analog phones. You dial it, the energy you exert even to make a call, and then at the end of the day, the call may not even go through. Where are analog phones today? They are no more. In the comfort of wherever we are sitting, look at this Zoom meeting, for instance. Now you can in this comfort of in the comfort of wherever you are sitting, you can communicate to any part of the world. What a beautiful thing. Why? Because of technological advancement. So technology is good. This digital age has brought a lot of good things. And that is the same thing we're experiencing in the field of medicine. There used to be medicine has transcended through different phases. We had the era of physiology, where you, as an individual, just feel that something is wrong with you, you just feel uncomfortable, and then something is not just well with you. And then from that era of physiology, it moved to pathology. If something is distorting your system, there must be a cause. So people began to study various kinds of diseases, pathology, to know what is causing the discomfort in the physiology of the system. Then from that era of pathology, it moved to era of pharmacology, where we are involved as pharmacists. People come, we administer drugs, we give drugs to people to treat whatever has been discovered to be the cause of such illness. But as I'm talking to you today, just the same kind of technology we are talking about, the world is moving from this era of pharmacology to the era of regenerative medicine. And what is regenerative medicine? Regenerative medicine can define this as a therapeutic intervention that replaces or regenerates human cells, tissues, or organs to restore or establish normal function. You see, what are the key things there? Cells, tissues, organs. You see, so it has to do with the system itself, the system regenerating itself or healing itself. So that is it.
Wow, so we are at that level of evolution right now.
Exactly.
Like you said, it moved from physiology to pathology to pharmacology. Now it has moved to regenerative
Medicine.
medicine. So we need to understand it. So let me see if I can assist you with my slide so that you explain what this regenerative medicine is to us and why we are looking at the option of plant-based stem cell uh, today. So permit me to share my slide. Do I have my slide on? Excuse me. 1 minute. Can you see the screen?
Yeah. The phenomenon, your health in your hands. Otherwise, talking about the stem cell revolution. You see, very briefly, let me just take us down memory lane a bit. In the 1970s, there was so much emphasis on the benefits of vitamins to healthy living. And so there was a lot of encouragement to take a lot of vitamins to maintain a good health and also to remain healthy. So people took various kinds of vitamins to remain healthy. And then when we got into the 80s, herbal therapy became very prominent as people saw and propagated herbal preparations, as plant-based, and so that it was devoid of most of the side effects often associated with chemicals or synthesized products. So herbal preparations were projected as being natural or from plant source with virtually insignificant or no side effects at all. That was up to the late 80s. And then when we came into the 90s, the abuse of herbal preparation became very prominent. So because every Tom, Dick, and Harry began to engage in herbal preparations even up till today. So we are all very much aware of the very unpleasant consequences most of these uncertified herbal preparations have wreaked on the society. With so many fatal cases of unguarded and very poorly prepared herbal remedies. But then came, after this era, the stem cell era or revolution. The stem cell revolution or the era of stem cell therapy or regenerative medicine, which we are in now, can be likened to the birth of a child of necessity, to correct all the anomalies of the past. So if you look at the stem cell therapy, it's an era of revolution which has not only been able to combine these factors successfully, that is vitamins, herbal therapy, and antioxidants, but has equally gone ahead to revolutionize these combinations to produce a top-notch confidence building, hope restoring, destiny changing, 21st century breakthrough product in the field of medicine called double stem cell, which
Woo!
can be employed in the therapeutic intervention to replace or regenerate human cells, tissues, or organs to restore or establish normal function. So in this, you can see that health is in your hands.
I need to take a deep breath in. I wish I can. That was heavy. All right, please help us understand the concept of stem cells.
Stem cells, from basic definition, we know a cell is the basic unit of life. That is the basic foundation of every human being. So stem cells are special cells called mother cells, and they have the amazing power to produce new cells that can transform into any tissue or organ in your body. And it is because of this wonderful ability that they have the potential to treat over 200 life-threatening diseases. And what is that potential? Ability to regenerate themselves. In other words, it makes them not to be exhausted, and then the ability to differentiate. You can see from this diagram, you see the stem cells there, which is the foundation. And then from the stem cells, it begins to regenerate themselves to form more of these stem cells so that they are not exhausted. They can have more of it to function in the body. And after the regeneration, it begins to differentiate. For instance, it differentiates to form the nerve cells, which are cells of the brain, forms the cardiac cells, which are cells of the heart that helps in the pumping action, the muscle cells, which are for the muscles, and then the intestinal cells, which are cells found in the intestine, and then the liver cells, which are cells found in the liver. So you can see that the differentiation of these stem cells confers different function to each of these organs. So because of the differentiating capacity of stem cells, it has been able to function in different dimensions. Functions in brain cells, functions in the heart, functions in the intestine, and the rest. So stem cells, just as we said, everything that grows, everything that has life needs to repair itself. So the cells in the body, by regeneration, gets is an ability, is what makes it possible for the organs to replace itself. Just as we age, don't forget it, that as we are getting older, cells become damaged or worn out. So stem cells are naturally present in our body, and they are like body replacement parts. That's when we get injured, we have the stem cells because they are there to help repair those cells that are injured. So, and one thing we must know is that stem cells diminish with age, and that is why nobody lives forever. So depending on our lifestyle, the kind of food we eat, the kind of expression, whether we do exercise or not, and then the environmental factors where we find ourselves, are we exposed to pollution? What kind of environment do we live? Depending on these factors, it can also affect our stem cells. And that is the more reason why there is need for us to deliberately nourish our stem cells.
All right. So what's the alternative? Because I know that there are different kind of stem cells. We have the adult stem cell, the embryonic stem cell. But what we're introducing today is the plant-based stem cell. So can we understand the origin?
Yes, the origin is just the ones you mentioned. The plant, the embryonic stem cells, the um, what's it called? The human stem cells or
Adult stem
adult
cell.
stem cells. Yes, the adult stem cells. That has been the foundation. You know, how does it begin? The sperm itself, it's a cell. That is a stem cell. When the sperm, which is a stem cell, fertilizes the egg or ova, which is also a stem cell, they form the first stem cell that forms the human being, the zygote. The zygote is the first stem cell in the development of every living being. So now that zygote begins to undergo cell division to form the embryonic stem cells. And it is these embryonic stem cells that begins to differentiate to form the cells of the liver. Take for instance, when the sperm fertilizes the egg, pregnancy results. You agree with me? And then the pregnancy continues to grow from the first week, second week, third week, up to the 14th week. Now, during this growth process, if you look at the picture of the pregnancy, it does not look like a human being, a normal human being. Instead, it looks like a tadpole. A tadpole is one of the early stages of the growth of a frog. So it looks like a tadpole, but from the 15th, 16th, 17th, 18th week, you see the head becomes prominent, the heads, the hands are seen, the legs are seen, the buttocks, you see the buttocks. As you can see these external organs, that is also how the internal organs are growing. The kidney, the liver, the lungs, the pancreas, the intestine, they are also growing, but you don't see them. What is it that is forming them? What is it that makes them grow? It's nothing but the stem cells. So it is the stem cell, just as we described earlier, that the embryonic stem cell differentiates to form cells of the kidney, cells of the liver, cells of the pancreas. It is that differentiation that leads to the formation of most of these organs. So that is the stem cell therapy.
Okay, so let's understand the plant alternative, the plant-based alternative.
Okay. Now, the study of stem cell goes down. It started over 30 years ago, you know, because researchers, scientists, saw that there was a future in stem cell. So they began to study, do research. America is one country that wants to lead the world and wants to be at the top when it comes to every issue of discovery and the rest. And that was one of the reasons why during the government of Barack Obama, excuse me, he used his powers to pass an executive order, and that order was to release funds for research to be done on stem cells. Why? Because they felt that there was a future in it. But there was success in it. There was no doubt about it, because with the research and then the discoveries that were made, stem cells were used in the treatment of most of these degenerative conditions that we had. Take, for instance, somebody who is suffering from sickle cell anemia or leukemia, for instance. In sickle cell anemia, the challenge here is the cells that are sickled. Now, the only way you can treat a sickler is to do a bone marrow transplant. And what does this bone marrow transplant entail? It entails flushing out the entire sickled cell and then replacing them with fresh stem cells, adult stem cells, which are usually injected into the bone marrow. So this will now begin to develop new blood cells, and that is how you treat a condition such as sickle cell anemia. Before, excuse me, before such discovery, what you do is to give palliatives, to just give some analgesics, some pain reliever, just to subside the excruciating pain. But with this technology, you find out that sickle cell could be treated by this stem cell therapy. So human stem cell, embryonic stem cell, even though it had its own controversies, had some breakthrough, because they were able to use it to treat some condition. But the truth is that most of these conditions were often associated with some side effects. Take, for instance, if you want to treat sickle cell anemia, for instance, I told you that you've got to flush out the system with in order to replace it with new, fresh cells, stem cells. Now, the process of flushing it out is either by radiotherapy or chemotherapy. And when you employ such means, it has a way of affecting other cells. For instance, the white blood cells, which is supposed to build immunity in the system, could be affected. The platelets, which is supposed to uh, function in stopping bleeding, could also be affected. So, because of this effect, a chain reaction of side effects could occur. Even though the patient eventually will be treated and will be okay, but years after, these side effects will begin to manifest. But someone along the line now began to think, just as there were studies on this stem cell therapy, people have also been researching on plant stem cell for years. But the good thing was that Dr. Fred Zuli now discovered, that from this Malus domestica, because it exhibited some unusual characteristics. First and foremost, you notice that when the plant is still growing and it's eaten by birds or it's caught, come back 3 days, 4 days, and you see that the thing heals itself. So first and foremost, they discovered a healing property in this Malus domestica apple from Switzerland, otherwise called Utwila spatuloba. Took it, cut it, and then exposed it, and discovered that unlike the usual apple, it does not degenerate. Get any apple, say from the market, and then you buy it. Before you finish eating it, it changes color. In other words, it oxidizes. But Malus domestica or Otwila spatuloba Swiss apple does not, because it does not get oxidized. Again, Dr. Fredzuli also discovered that when this species of apple is harvested, it has capacity to stay for 1 month, 2 months, 3 months, up to 4 months without getting wrinkled. Which fruit can stay that long? None. And apart from that, it does not get wrinkled. So they just knew that there's something that beholds the eye, something beyond what they could see or what they were seeing. And that was how research continued. And with this research, they discovered that one, it has abundant supply of antioxidants. And this antioxidant was primarily responsible for the preservative effect of this apple. And secondly, they also discovered that it has stem cells. And with further research, he discovered that stem cells from this Utwila spatuloba Swiss apple has capacity to regenerate human cells. In fact, it got down to a quantity that 0.1% concentration of this phytocell tech has capacity to activate or regenerate 80% stem cells in human body. That was a fantastic breakthrough. That was a fantastic breakthrough. And that was why it won an award in 2008 as the most innovative raw material active. Why? Because never in the history of medicine has there been such discovery. So with this now, most of the side effects, often associated with stem cell therapy can now be addressed. Why? Because this is coming from a plant source, and plant are natural products devoid of side effects. So this is the breakthrough and a very interesting discovery.
Oh, wow.
And
Yeah, go
with
ahead,
this,
sir.
yeah, with this, after this discovery, our late CEO, may God bless his soul, this man was very smart enough, to sense, and then was also able to act. He knew that the stem cell, therapy has something in the future. So he went quickly and signed a memorandum of understanding with Midwell Biochemistry. And what is the importance of this ceremony? It confers on Phytoscience the exclusive ownership of the double stem cell and triple stem cell formulation. In other words, Phytoscience owns the product, owns the formulation, so it's an exclusive ownership, of this product, double stem cell and triple stem cell, and that is a very great one.
So what this simply means is that since Dr. Fretzuli is the scientist that discovered it, so they are the originators of the plant-based stem cell, and since Phytoscience is the exclusive owners of the formulas and the patent, it means that it's not possible to get stem cell-based products from another company, no matter how they
Exactly.
parade it.
Excuse me.
Sorry, sir. Maybe you should get water.
Yes, I should. Exactly, that is it. The exclusive ownership is such that, you see, in the field of pharmacy, there's what we call drug formulation. If you formulate a drug, we have a formula that we use in formulating or preparing uh, maybe drugs or mixtures or what have you. And if you follow the formula, if you prepare it in Nigeria, it will be the same thing in America, it will be the same thing in Britain, it will be the same thing in South Africa. Why? Because you are following the outlined formula for such particular product. So for the fact that it has conferred on Phytoscience the exclusive ownership and formula for this product, no other person has it. They have the patency, and because of this, no other company can have it. Now, what is it about formulation technology? That is everyone's selling point. That is your strength. That is what distinguishes you in the market. For instance, in the field of medicine, we have different kinds of. I made mention of ampiclos recently because it's one of those drugs that is readily abused and wrongly too, for that matter. There's this ampiclos by a particular company. It's very costly, it's very expensive. If you buy it and use it, you get a very fantastic result. It's not as if you don't get results with others. You do. But because of the formulation technology involved in such formulation, you get faster results. There's a brand of paracetamol in Nigeria today that works 5 times faster than others. You see, because it has to do with its constituents, the things that are used, either the binders, the starch, and then the brand of or quality of the paracetamol powder that is used. You have first grade, you have second grade, you have third grade. So depending on the quality of the paracetamol powder that is used, that will also determine the quality of the product that comes out of it. So there's a particular brand that works faster than other brands. Why? Because of the formulation technology involved. So what I'm saying in essence is that once once a product is formulated and you have a copycat of that product, they can never be the same formulation. And because they are not the same formulation, they can never exhibit the same effect or result. Yes.
Whoa, I like that. In fact, I don't even know if these 2 hours will be enough for us because we've not even touched the product as it were, and it's already very, very, very eye-opening for even me. Okay, so let's try and understand this product. I know it's your core, and I know you would want to expend time on it, trying to make us understand, but we only have like 20 minutes to do this because I know that a lot of people will want to ask you a question or two. So in 20 minutes, let's touch about 3 or 4 of the products, looking at their composition. You understand these things very well, looking at their composition, and just in brief, explain these products to us and why they are that efficacious. The efficacy is very, very, very high. You made us understand that you can have products that look the same, but they don't work the same, they don't act the same. This takes me to our hospitals here, where they give you this unbranded paracetamol that now you're talking about first grade, second grade. I don't know if it's 10th grade that they put in all those funny looking bags and they hand over. Now, with your explanation, it just tells me that they want us to keep coming back. So they just give you the low grade one, you use for a while, it looks as if it's working, and the next thing you are back again 2-3 weeks after. So the formulation is very important. The technology, I mean, used is very important. So take us through, like, let's see if we can run through 4 of the products. Let's look at double stem cell, crystal cell, snowfield, and maybe Actra Plus if time permits us. So like I said, we have 20 minutes to get this done. So let's start with double stem cell, sir.
Wow, 20 minutes. Well, let's see
Yes.
how we go.
So that we can so that we can take, because I know people have questions to ask you, so that we can take as much as
It's
possible.
all right. It's okay. Let's go. Now, double stem cell, that's the flagship product of Phytoscience. And usually, what makes the product are the contents, the constituents, or the active ingredients, or the actives. Double stem cell contains acai berry, blueberry, Swiss apple, and Burgundy grapes. So these are the things that are responsible for every activity exhibited by double stem cell. Now, the first thing there is the acai berry, often referred to as or hailed as a superfood among health professionals. And why is this? Because it has been linked to so many health benefits, because it has abundant supply of nutrients that it contains. And then, what are the benefits? It has capacity to reduce bad cholesterol. It's good for diabetes. It can improve immune system. Yes.
Okay, so under this bad cholesterol, can you help us? I see this a lot, that it has 2 essential fatty acids. Usually, when we hear things like fatty, we don't even want to go further before we just conclude that anything fatty is bad. So, what's omega 6 and omega 7 fatty acids? What's the relevance?
Yes, omega 6 and omega
Omega
uh,
9, sorry.
nine fatty acids, they play a very important role in maintaining cholesterol levels to normal, as well as reducing it when it is going beyond the level that is beneficial to maintain good health. In other words, they serve as a gauge watching over to ensure that the cholesterol level is brought low. And then if it gets going higher, it reduces it to the level that is acceptable, that do not, excuse me, that's beneficial to maintain good health. You know, cholesterol actually is a substance that is found in all the cells in our body. The body needs it actually to make hormones, to make vitamin D and substances that help in the digestion of food. But the one that is bad here now, just as the name implies, bad cholesterol, is the one that is referred to as LDL, the low density lipoprotein. So when LDL level becomes higher than normal in the body, it poses a health threat. You know, as the person becomes exposed, you know, or is at risk to developing a heart disease or stroke even. You know, so that is why this cholesterol plays a very, is very, very significant. And that is why this essential fatty acid of omega 6, omega 9 play a very active role. They are very, very important because they help to reduce cases of stroke or heart disease. Yes.
Okay, what about this glycemic index?
Okay.
What is
Glycemic index. It's just like for good for diabetes. You know, for patients that are uh, diabetics. You know, glycemic index is can be imagined as a scale. You know, it's a scale that ranks the number of carbohydrates, you know, in food. You say from 0 to 100, you know, and then it indicates how quickly a food causes a person's blood sugar to rise. So if somebody's glycemic index is say, since we are saying from 0 to 100, you say 20 or 30, for instance, below 50, you could say that it is a low glycemic index. So above 50, 60, 70, 80, 90, you could say that such glycemic index is high. So acai berry has a low score on glycemic index. So what it means that it does not cause spikes. You know, when the patient takes it, whether you are diabetes, you take it, it will help to bring down the levels of fat, you know, in the system. So glycemic index is a scale, you know, that tracks the carbohydrates, you know, from that level, you know. So it indicates again how the food causes a person blood index. So with this acai berry, the good thing is that it helps you to treat diabetes. So food that is high on glycemic index can cause, harmful blood sugar spikes. So you have it causing things like diabetes. So when a particular food has low glycemic index, the tendency to cause diabetes will be very, very small. So that is why acai berry is very good for diabetics
Amazing.
because it has a low glycemic index. Again, improves immune system. You know,
Okay.
okay, acai berry adds it aids weight loss. It has been linked to weight loss and weight loss management. It is also a good food to curb cravings. So what the essential things here that acai berry, because of the fact that when you eat it, it gives you a sense of feeling. It suppresses your craving to eat this, eat that, eat this. And usually we build weight. We become obese or excessively overweight because of what we eat. Most times our cravings for food. You see this one, you eat. You see this here, you eat it. You don't have control over what you eat. But when you take acai berry or the component of acai berry in our product makes it possible for somebody to not have that nudge to eat anyhow. So it helps to control excessive weight, and that is how it aids in weight loss. So it doesn't allow you to eat carelessly so that you begin to build weight carelessly or unnecessary. Again, acai berry has been also noticed that the pulp has been noticed that it reduces fat deposit in the body. So as an anti-aging agent too, because of the high level of antioxidant that it contains,
Okay,
it
run us
has,
through the remaining. Okay.
yes, it boosts energy. The result of all the benefits listed above is that acai berry may be good uh, to build the energy of the body. It will make the body healthier, and as a result, it will increase stamina and energy as the body works more efficiently. It's also good for the brain. The anti-aging property, that it has extends beyond the skin, and so the brain too. A brain that is aging so slowly can work, or that does not age fast, can work faster and more efficiently. And as a result of this, acai berry has been linked to improving cognitive function and alertness. It makes you to be more alert. It's cognitive function that has to do with intellectual function, your ability to learn, comprehend things, and then having a very good sense of judgment. It also has the ability to remember or recall what has been learned. These are the things that acai berry, what it does for the brain. Again, it also promotes a healthy heart. Acai berry contains a specific kind of antioxidant called anthocyanin, which is also present in red wine. Now, blueberry. This is another component of our stem cell. So, biologically, it is called Vaccinium corymbosum. They are tiny, individual colored edible berries and have a sweet taste. The anthocyanins that it contains are responsible for the blue color. Blueberries are packed with antioxidants and phytonutrients called phytoflavonoids. They have a very high content of potassium and vitamin C. Potassium is a mineral and has electrolyte, and it helps the muscle to work very well. So in other words, it is very good in the maintenance of blood pressure. It also helps the muscles of the heart. Yeah. If the heart must continue to function as a pumping organ, potassium must be available. It is a must, So it has that. Blueberry protects the heart, because it contains fiber, it contains anthocyanins, potassium, folic acid, vitamin B6, and vitamin C. You know, Fiber and the anthocyanins help to reduce cholesterol, which in turn lessens of self clogging of arteries. One of the things is that when the arteries become clogged, it will not allow the easy flow of blood. And so blood flow becomes very tight, and that is what causes blood pressure to rise. So, but vitamins B6, folic acid help in mitigating damage to the blood vessels. How do they do this? They inhibit the buildup of a substance that is called homocysteine. So that is how it helps to protect the heart. Homocysteine is one substance that if it goes high, it's not good for the blood. Yes, and then it also suits inflammation. Antioxidant, because they are contained in blueberry, it helps to soothe inflammation. And inflammation is often associated with any diseased condition or pain or injury, in the body. It also serves as an antidepressant because of the flavonoids that are rich, in blueberry. So it helps to keep one's mood on. You are not depressed, you are not down in spirit. It helps you to be active, and it also promotes digestion, and then it also helps in the treatment of urinary tract infection. Just like cranberries, blueberries are known to also alleviate UTI. They both have certain antibiotics, that properties, and the compounds that prevent bacteria from sticking to the walls of the bladder. And when bacteria does not stick to the wall, there will be no way, it can cause infection. Again, eye care, as a result of the antioxidant properties, blueberries can delay age-related ocular problems. In other words, the antioxidant, you see, most challenges in our health is as a result of a buildup of free radicals. And when these free radicals get to certain level, they begin to cause what we call oxidative damage or oxidative stress. But antioxidants are substances that counteract the effect of these free radicals. So when these things appear in the kidney cells begin to degenerate. When it appears in the lung cells begin to degenerate. Wherever they appear in any part of the body, that is where it will be affected. Now, the second product is our crystal cell. Crystal cell is also one of our products. And just like double stem cell, it contains acai berry. The only thing that instead of having blueberry, it now has tomato in it. And this tomato also has its effect because it is an antioxidant called lycopene, which has been linked to so many health benefits, including reduced risk to cancer, and then other heart diseases. They are also a great source of vitamin C, potassium, folic acid, and then vitamin K. Yes. What are the benefits? Lycopene is also known to improve the functioning blood vessels in general, and it can help to reduce blood pressure. And research has shown that it has effect to lower high blood pressure. It has no effect on normal blood pressure. So what does this mean? If you are taking it and your blood pressure is normal, it does not have effect on it. But when it is high, it reduces it. It helps to prevent cancer. Lycopene in tomato has anti-cancer properties, and that has also helped to prevent the proliferation of several cancer cell types. Yes. So tomato has a way of helping to treat cancer. There's even a drug that is called lycopene, which is used in treatment of prostate cancer. Tomatoes improve skin and hair health. As an ingredient of beauty treatment, they help cure large pores. They treat acne, soothe sunburn, and they revive dull skin. All boiling down to the antioxidant that they contain, especially lycopene. Lycopene has capacity to fight cellular damage. Again, anti-inflammatory effect. The presence of phytoin and phytofluin produces anti-inflammatory effect, which helps to speed up the healing wounds and also restores acne scars. It has also capacity to protect DNA strands in the skin cells against damage that are caused by harmful environmental agents. Yes. How do you take double stem cell? You can see from the diagram that a product that is usually administered sub- sublingually. You know, you don't chew it, you administer it, you raise your tongue and pour it under. You know, you have a lot of blood vessels under the tongue, and even as you pour it there, the buccal cavity, the size of the mouth also age, they're highly vascularized. So the little ones that drain out from under the tongue and get to the side are also rapidly absorbed, and then they get straight to the blood. And you take a lot of water, it's very important. If you must take this drug and taking it effectively for it to work, for you to get the benefit from it, it must be taken with water. It's a product that works in a hydrated environment. In other words, it needs water to perform its function. And what is its function? Cell division. The cells will continue to divide, so it needs water. So ensure you take a lot of water. Snowfield, Snowfield Fort is also another product of ours. It's a very wonderful product. And what are the active ingredients? It has the mulberry leaf, you know, this is one of them, one of the products. Mulberry leaf is known for its potent sugar blocking properties. It blocks sugar, and you see with this, it will be very effective in the treatment of diabetes. It has a particular element that it contains, one the oxynitromycin. This has capacity to control the absorption of sugar and antioxidants that help to decrease damage of free radicals. So you can see free radicals again, antioxidant. So most of the damaging effect is boils down to the presence of free radical. Again, the second product that it contains is in snow algae, which grows on harsh environments such as glaciers, you know, where it naturally produces valuable stress response molecules. Snow algae stimulate the production of a longevity gene that promotes cellular defense and energy. So it has capacity to keep the body defended against any form of attack. And then wheatgrass, that's another component of our snowfield fort. Some studies have shown that wheatgrass acts as an antioxidant because it contains vitamins A, C, and E. Antioxidants reverse the effect of free radicals, that I've already explained, and these volatile compounds in the body have links to aging. Of course, every free radical contributes to aging. Antioxidants help to fight chronic inflammation, which occurs when the immune system reacts to particular health issues such as arthritis, stomach problems, skin tissues. Antioxidants might even help with mental health concerns such as depression. Another important um, thing about snowfield fort, is that it helps to reduce hemoglobin and red blood cells. The blood, as we know, is a river of life and energy, because that is the means by which food is transported around the body, oxygen, and everything that is essential to keep the body functioning down to the cells. So snow algae chlorophyll resembles the blood structure and can help rebuild and replenish the blood in our body. It is rich in magnesium, which gives it an alkalizing, cleansing effect. It has capacity to boost our body with energy and reduce fatigue. So if you take snowfield forward, you can stay active, full of energy, strength and vitality. Yes. Again, another good thing about this product is that it detoxifies the body. It has capacity to flush out toxins, into and toxins, is responsible for most of the chronic illnesses. The snow algae reduces the binding of carcinogens. These are substances that cause cancer from cooked meat, and that's why we are advised not to take a lot of red meat, because they contain carcinogens, and these are substances that cause cancer, and they have ability to damage the DNA and other organs, especially in the liver. So for the fact that snuffing forth serves as a detox, it has capacity to cleanse your body, to free them from these carcinogens. and that is what is referred to as cleaning from within. It also helps in the management of blood sugar and weight loss. You know, the combination of slow agar and mulberry leaf is known to is caloric restriction. You know, calorie restriction. You know, that means you don't build fat unnecessarily. You know, if you're using blood sugar spikes, it will suppress your craving for food and prevent fat from depositing in your body. It aids in gastrointestinal problems. Most major diseases that start in the colon, snow algae contains chlorophylls that are known for loosening and cleansing the colon. So it's very good in cleansing the colon so that digestion and assimilation of food can take place. Finally, we come to our product referred to as Actual Plus. Actual Plus actually is the best way to boost, contains a lot of uh, fruits, vegetables, and then spices. 15 fruits, 12 vegetables, and 9 spices. What are the ingredients? One, soursop. Soursop has high antioxidants, and this can help to kill cancer cells. So it can also help to fight bacteria, reduce inflammation, and helps to stabilize blood sugar. Mangosteen is another component of Actual Plus. What does mangosteen do? It boosts immunity. So you can see that this product can be used to treat cancer, it can be used to fight bacteria, it can be used in the treatment or to boost immunity. And a lot of testimonies we got when people use this, especially during this COVID-19, you know, pandemic. It can also help for menstrual problems, regulates blood pressure and boosts heart health. It has anti-inflammatory properties, can boost skin care, and there is a solution to your tummy problems. Noni. Noni lowers the risk of gout caused by the buildup of uric acid, you know, in the joint. Gout is a kind of arthritis which causes joint pains. You know, it can improve the quality of the skin. You know, it's good for people that are suffering from arthritis, anti-aging. You know, it has capacity to reduce stress and it can also boost immunity and treats fever. So these are the things that Monday does, and it's also a component of Actual Plus. White wild ginger. This one reduces cholesterol level. It reduces stress and anxiety, pain. It's a pain reliever. It's an anti-inflammatory. You know, it's a body warmer. It helps to warm the body, and then can be used in the treatment of inflammation too. Red beans. This one improves digestion. It balances sugar level and reduces the risk of diabetes. You see, another diabetics again. You can see so many of them, so many of these products have good effects on diabetes. No wonder the product is very, very good in the treatment of diabetes. It improves bone and skin health. It could serve as a detox too and help in aids in weight loss. The black cumin seed, you know, this has a favorable effect several parameters related to heart diseases, you know, including lowering LDL, which we discussed earlier on, low um, this cholesterol that is bad, often referred to as the bad cholesterol. So it has capacity to reduce it and can also lower the blood pressure. It reduces plaque formation. You know, when plaques are formed on the walls of the blood vessel, it will also help to cause what we call atherosclerosis, which is often associated with high blood pressure. It also reduces blood glucose as well as diabetic associated complications such as neuropathy, a condition where you begin to lose sensation in the nerves. You know.
Whoa, Farm Jude, this is as much as we can take. It's been 1 hour plus of intense value. 1 hour plus of intense value. Ladies and gentlemen, please can we appreciate Farm Jude so far for amazing work of enlightening us on first and foremost what drugs are, what the composition and with side effects, helping us to understand that, and also giving us the advice that we shouldn't self-medicate under no circumstance as much as possible because they are all potentially toxic. It needs to be guided and you have the right dosage. Now it's also taking us to alternative, which is the organic, that we can use to also help to treat and address a lot of health challenges. Please, once more, let's celebrate Farm Jude as we open up the room for questions because I know there are a lot of people that have questions to ask you. First and foremost, let me ask this question. Is double stem cell, uh, all the products, are they classified as drugs?
No, double stem cells are neither drugs nor supplements. Double stem cell is in a class of its own. Double stem cell is a departure from what was the usual thing or usual practice. It is the first of its kind. And that is one thing that it has even built my interest in it, because it is not a drug that I studied. It is not a conventional way of treatment. So it's unique. It's a stem cell. You know, it's a stem cell. It is what the body is made up of. If you have an understanding of the genesis of stem cell in the body, you appreciate what this double stem cell is. So double stem cell is not a drug, it's not a supplement.
Okay, so now that you say it's not a drug, so we would not be expecting it to have the same pathway as as the drug where you take for 3 days, or you take for 7 days, all those kind of regulations. Would it be right if I say so?
Yes, but you see, in the case, so because it's not a drug, you see, drugs are certain things, are chemical products. Before you come up with a prescription or a recommendation on how a drug can be used, you must have certified to know the pharmacokinetics. I'm sorry if that word is a strong word I don't understand. Pharmacokinetics, or with that or the profile of such drugs. In other words, when a drug is taken, how long does it last in the system? How does it do its work? All these things are studied. And that is why some drugs are administered either twice a day or thrice a day or once a day, depending on how long they stay in the system. But the truth is that every treatment goes through a time period, you know, depending on the drug we are using and then depending on the treatment. In stem cell therapy, of course, it is something that will also take time. But you see, the time will depend on several factors. You see, individually we have different genetic constitution or genetic buildup, and that will also affect the way stem cell works in our body. And that is why some of the results we've gotten, you see somebody taking a 1 pack or 2 packs for a particular ailment and he gets certain desired result, and another person needs to take more packs than that, simply because our body system is different. So just like conventional medicine that is taken for some time, stem cells too should be taken for some time, because you take it to build more cells in the system. So you should take it for some time.
Okay, so we don't expect to take it for 3 days and assume that it has to work because it works for one person in 3 days or in 6 days. So when we say it's a therapy, it means it has a period of time that you should um, primarily take it for before you start seeing desired results in the area of treatment. Okay, so my co-host, do we have people in this room this evening? Are we getting value?
Yes, so
Are we
Yes, we
getting
are.
value?
Yes, we are.
Okay, so my co-host, let's move to our participants. Does anybody want to ask a question?
Yes. We have 2 hands raised.
Okay, so
Let's start with Chinyenwa. Chinyenwa, you in the room?
you have to unmute.
Yes. I've asked her to unmute herself. Chinyenwa, please unmute yourself.
Do you have a question? Okay, let's move to the next person if she's not ready.
Okay. The next person is Baba Anka. Please unmute yourself.
Madam Anka, go ahead.
Madam
Are
Anka,
you
please.
sure? Are you sure my hands were raised?
Yeah,
It's been raised.
Well, I want to appreciate our speaker today. It's been awesome right from the beginning. Let me let you know that people have been clamoring that they want a recording of this. It's just been awesome. From one information to another, you've just been dishing out. Like we haven't heard of this even before now. No wonder it's from a professional. We really appreciate you. And we can see that what we have for us is a real thing. In fact, that just struck a chord in me that the imitation cannot be like the real thing. And when pharmacist said all drugs have side effects, I agree. If I take paracetamol, common paracetamol like this, I've had burns for days thereafter. And so if I have alternatives for this, I mean, I just go for it. Thank you so much for informing us of all that we have in our products. Thank you, sir.
Welcome, man. Thank you very much.
Thank you, Madam
okay.
Anka.
Okay,
Yes.
so
We have Chaha. Chaha's 9-5. Please unmute yourself if you're in the house. Chaha, can you hear us? Okay.
Yes, I can.
Okay, please go ahead. Good evening.
My question is, a 79-year-old woman recovering from stroke, what can she take and what quantity?
okay. From Jude, are you there?
Yeah, 79 years. How old has that sickness or ailment been?
I think 2 or 3 years. Now she walks with the aid of she can walk. Before she was just recovering from a stroke. She can walk with a stick now, but she still finds it difficult.
Has
And
it been on? Okay,
I
I'm listening.
just introduced the product to her today. So she was not telling me what and what can she use.
Okay,
That's asking the question now, so I will know what to relate back to her tomorrow. I told her there will be. I even gave her this thing to join, but as an old woman, I don't think she'll be able to join. I did not see her because I gave her an invite to join and listen herself. But she's not here. So I want to know so that I will know what to say to her tomorrow when I go to her place.
you can get for her double stem cells, crystal cells, and snowfield forts. That combination will do a very good job for her. Double stem cells, crystal
And
cells.
how
This snowfield fort can be taken once a day, and then she takes a mixture of double stem cell. You take double stem cell in the morning, and then take crystal cell in the evening every day. Make it one sachet of double stem cell and one sachet of crystal cell, and then snowfield fort one sachet every day. I think that
what
would
is the
be healthier. Yes.
thank you.
And then as he takes it, he monitors the progress. He takes it, he monitors the progress. Yes. And don't forget, hello ma, I hope you are hearing me.
I'm hearing.
Don't forget, as I said earlier, that stem cell therapy, especially with these products, our products, double stem cell and crystal cell, plant cell products, has to be taken with a lot of water. This is very important. I'm laying emphasis because if you don't take it with enough water, being that it's a new person, you may begin to have some uncomfortable effect. And before you know it, you say the drug is causing some things that you are not having before and you are discouraged, you don't want to take it. So please bear this in mind. Encourage him or encourage her to take plenty of water. It's very important.
Thank you, ma'am. Okay, next person.
Okay, we have Ewoma Zeno. Ewoma Zeno, please mute yourself.
Hello, good evening, everyone.
Good evening.
Can you hear me? Okay. I have a question concerning someone's health. So the person is a male who is in his late 50s. He was recently diagnosed of pancreatitis, and I think he was diagnosed of diabetes. He's not really coming out straight because he doesn't want people that care for him to worry so much. But he said to me that he said it casually. And now we notice that his legs are caving in, like he's not walking straight. His legs are kind of bending. I don't know what is happening to his legs. And that has been the major concern. So I gave him just a sachet of DS. And I want to ask, what can we give to him? What can you suggest he takes? Because these are the challenges he's faced with at the moment. So that's my question. Thank you.
Okay, you see, when you are treating any ailment, it's also very good, just as we are advised on Sunday by our leader here in Nigeria. You know, medical what's it called now? Assessment. It's very, very important. From time to time, it's good to check yourself, check your health status. For instance, now you are treating what is it called? Diabetes, pancreatitis. It's an inflammation of the pancreas, and Snowfield 4 does a fantastic job. But that's not what I want to say. Now this person is presenting with diabetes. Do you have an idea of what the level is? It's very important, because if it's not just about the person taking this product, once you establish, or I think I would advise that you go back and tell him to go run a test to know what level that diabetic condition. It's very important. So that by the time he starts the treatment, he'll be able to monitor and know how far he has gone. So please, as soon as you leave here, let that person go and run a test. Now, you are beginning to see some complications developing. You never can tell what other complications that may come up. So it's very, very important the person knows what level it is, because diabetes is not a very good ailment at all because of its complications. It has a lot of terrible complications that one would not toy with. So please ensure you advise him to go run a test to know what the level is. But be it as it may, let him be on Snowfield Fort, double stem cell, and Actua Plus. This will help him too. Yeah. Hello?
Yeah.
Hello? Did you hear me? Hello?
I'm sure she's muted now. I'm sure she.
Okay, it's all right. It's okay.
Yeah, I'm sure she had you. And a
Sorry.
woman, you can also, when you get further details, you can get across to your sponsor if you still need further advice, so that they can link you up. Okay. Woman, give me a thumbs up if you heard what I said. A woman. Ewo
Yes,
Mazino.
on that.
Okay.
Is that okay, ma? Yeah.
Good.
Okay.
Okay. Okay.
Okay.
So do we still have one hand?
Yeah, we have Otumba Chas Ononuga. Please mute yourself.
Thank you very much. Thank you very much. Good evening, everybody. Please, my question is to the pharmacist. I woke up this morning. I'm probably thinking I didn't put my head properly on the pillow, and since then I've been having this very serious pain on my neck.
Otumba, sorry, we are laughing. There's a reason we are laughing. Once we are done, I'll tell you the reason why me and Asato
I'll tell
just
you.
Okay.
Even before the pharmacist. Okay, go ahead.
So the headache is so severe right now, and I really want to suppress it. So I only have a double stem cell with me. That's all I have. I don't know either that would do the, the magic. Yes.
Okay, let me tell you why we laughed before the pharmacist chipped in. Why we laughed was because just this afternoon I had a discussion with Osato, and what you said was precisely what she experienced just 2 days ago.
Wow.
So that was why when you said it, we just laughed because there's something that she did that worked for her, and I'm just like, can you imagine life testimony? So Sato, go ahead and share what happened.
Good evening, everybody.
Evening.
Yeah, Otumba. Good evening,
Yes.
sir. Yeah.
Good evening, ma'am.
On Sunday evening, I had the same issue. I think I slept, on the wrong side, my neck. So when I woke up, it was very, very painful. My husband had to help me to massage. When he was doing that, I thought of Miracle Intense, and I saw Miracle Intense. My husband was like, no, let's use Rob, Miracle Intense. And I agreed. He did that, and the pain didn't just go down. It became quite excruciating. You know that kind of pain, you can't bend your head, you can't do anything, like you have headache, you're carrying something on your head. Yes. And throughout the day, even at work, I'll stand up, at a point, it was spreading all the way down to my waist. So when I go back home in the evening, after having my bath, I wanted to go for another massage. And I thought of it, I said, let me try this Miracle Intense. And I took it. I sprayed it on my neck, but I couldn't, go all the way. So I called my daughter to help me spray, that she should just be generous with it. And she did. I decided to just lie down. And, I wanted to change my position, not even up to 15 minutes. I wanted to change my position. I noticed that, is it this neck? I turned my neck and I jumped up. I started shouting, is this a joke? Is this a joke? And I speak now, you can see my neck, the pain disappeared. So if you have a Miracle Intense at home, or if you can lay your hand on Miracle Intense, spray this night. In another few minutes, the pain will be gone.
Okay.
Yes, sir.
Thank you so much. Thank you so much for that. But Didi and the leaders in the house, please, I think you will help us. Yes, I keep shouting, making noise about this. There are demands for phytoscience products. There are plenty of demand, but we are not getting it. We are not getting this product. We cannot keep promising people.
There are products. There are abundant products now, as I speak. There are products.
Well, we discussed this yesterday.
Okay.
We have orders already in Nigeria. Our orders are already there.
Okay, you are in BFAT team, right?
Yeah, I'm in UK.
Okay.
Yeah, BFAT, that's right. BFAT was aware of it as well. Okay.
All
right. Was aware. Please help us.
I'll have a discussion with him so that I know what exactly the challenge is, because I'm aware we do have. I'll have to have that discussion with him. So by tomorrow we'll get back to you, sir. On what.
Okay. Alternatively, in the absence of this Miracle Intense, what can I use? Because I don't have it.
Oh my goodness! I wish you. Maybe we should find out who has around you, because the minute Osato told me about it, her experience this afternoon. My first daughter, didn't go to school today because she woke up to serious headache. She was having the headache like even on Sunday. So it got worse this morning. Her whole backache. Yesterday on Sunday, her father used Rob, the almighty Rob. to massage her back because I mean it was really painful for her. Then by the time she woke up this morning, she was just totally down. She said her head is still heavy, that her back, then her knees is the pain has gone all the way down to her knees. I didn't even think of miracle intent. It didn't even cross my mind at all. So I just gave the regular ones I knew. And the father said, okay, when he gets back, that maybe we'll take her to the hospital, let them find out what exactly is wrong because she hasn't complained like that before. So after my discussion with Osato this afternoon, and she said she used miracle intense. I just said to think about it. There's miracle intense here. I just called her. I said, come and lie down. My husband was looking at me that what's going on. So I now narrated Osato's experience and said, let me give it a shot with her. So she laid down and I sprayed it on the back, the lower back, then on her knees, and she went to bed. Now she woke up like 2 hours or so after. I remember that I went to her. I said, how far? She said, the pain in the knee is gone and the back is really subsiding. And I was like, whoa. I even told her that the pain at the back is totally, I mean, the knees is totally gone. And the one at the back has subsided. And I was like, I'm going to put you on the spot this evening so that you can share your testimony. But she's a very shy person. And she was like, Mom, no. So indeed, I don't know. And the question Sato asked me was, what is the miracle intent? That it just leaves after its name. So it's very, I've seen it work
I
a
don't
lot.
know.
I've seen it work a lot for pain. So I don't know who's around you there that we can get to this miracle intent across to you.
I think I will contact Faulty Fabulous, Best Life, and I will contact them tonight because I'm really I'm bad. I'm feeling bad.
You will get a good relief from it. It's almost like an instant pain reliever. It helps to relieve.
I'm telling you.
I don't know what is in it really, seriously, but it does work for pain. So in the interim, you can use your double stem cell, and while you work on getting miracle intent. Foundry, do you want to chip in anything?
It's okay. What you said is okay. Miracle intense is that must be some sprain on the muscles, the muscular sprain.
Okay.
I don't know how it does it. It has a relaxes it, and it just gets to go. So miracle intense is
Gigi, someone just offered. Yeah. Someone just said she has one at home in the UK.
Okay. Fantastic. Sope Alive.
Yes.
Alive. Okay, so we'll get the contact so that we can link you to get a miracle intense from her.
Okay, from who, please? From who?
So Lope, how can we reach you? Who's your sponsor? Can you help us so that we can reach you after now? Can you get her unmuted so that we just seal this right here now?
I've done that.
Okay. Lope, please, how do we get in touch with you?
Hello.
Okay.
Hello. Good evening.
Yeah, good evening.
Good evening. How are you, ma?
Very well, thank you, ma.
Thank you very much for this evening. It's very.
Thank you so much, first and foremost, for offering to help.
Oh,
thank
no problem.
You so much, ma.
That's why we are in it together. I don't know if I have his number. If we exchange numbers, I can get in touch. Then we'll see where he lives and we can get it across to each other.
Okay.
I don't know where Otumba lives. I live in where do you live, sir?
How do we?
I live in Hertfordshire, in UK.
How do we do this now? Brieford, are you in the room?
I live in Manchester, so maybe we have to.
Oh, okay. I think what I would do is, let me find out from Fabulous. If she doesn't have, if Faulty doesn't have, then they will get it for me from you in Manchester.
Okay,
then Fabulous can send it to me.
Yeah. All right, that's fine. Didi, good. If you get in touch with Soft Mind can get in touch with me.
Okay. Okay.
Okay, ma'am. So please do me a favor. Can you just send me your number privately so that I have that on standby?
Okay.
Okay.
Yeah, you can send me your number privately.
All
so
right.
I can connect if we eventually will still need your help. Thank you so much, ma'am.
All right.
I appreciate
You're welcome. Yes. Thank you,
Didi.
Yeah.
Thank you, ma'am.
So I'm
Thank
looking
you.
out for your
Thank
number,
you,
ma'am.
Thank you.
Thank you.
All right, Otumba, you'll be fine. And next time, please sleep well. Don't,
I
don't
will
sleep
try
on
now
high
that
pillows and all
now
that.
that Mr. Jude said it's just a muscle pull from the neck.
Muscular strain, yeah.
Okay, muscular strain. I will relax my head on that because I lost my son-in-law in this July because of headache, because of this head thing, and he had benign brain tumor, and he suddenly went into a snapshot, and that was how we lost him. Unfortunately, he didn't let us know on time at all. He was hiding it. He was keeping it to himself. Sorry. Was that an interruption from somewhere? Yeah, so that's what happened to me. So that's why I'm making noise now so that I can quickly get help. I'm really, really in pain. Thank you.
Okay, we have to wrap up.
Someone just sent a private chat.
Excuse me, sir.
Judy, sorry, someone just sent a private chat. Maybe we'll send the number to Otumba later.
Okay.
Yeah, someone just sent a private chat. The person lives near Otumba. So we'll send the details later, maybe through BFAD.
Okay.
Yes, she lives very close to you, and she has.
Okay, Faulty just responded that she doesn't have, so we would have to look at all options. Yeah.
Excuse me, there's something I want to say, sir. Hello,
Yes.
sir. Can you hear
yes,
me?
I'm listening. Yes, I'm listening.
Apart from the neck pain, are you still talking about pain in your head?
In my head as well. In my neck.
Neck. Okay. For how long have you had the one? Have you been feeling the head pain?
It's since morning. I thought, I thought it would go away, but
have you checked to know what your B level is?
My B level?
Yes. When did you check it last?
Blood pressure, BP.
Unfortunately, I haven't been checking that for some time now.
Please.
I'm just one of those. I'll go and check it now because my daughter shouldn't even hear that she bought me a blood pressure gadgets and I'm not checking my BP at all.
Please, it's very important. Very, very important. Check it this night before you go to bed, sir. Please.
I'll go and check it now in under 5-10 minutes.
Please. And if you can check it, and then and you know what the level is, you could just send me a message. Let me advise you on what to do, depending on what level he is. Please go and check it. It's very important. I'm talking from experience. Go and check it, sir.
Okay.
Yes, sir.
Thank you so much, Famke. So Otumba, you can get a message across to us just in case we wrap that up in this.
Okay.
Yeah.
Okay.
Sorry
about that
noise.
Is Otumba's baby okay? Okay.
Okay, we have Epsiba. That will be our last question.
Epsiba. Okay. Yeah, we have Epsiba in the room with her hand raised. Please unmute yourself.
Okay, thank you very much. Thank you so much, Madam Didi. Thank you, Madam Osato, and the doctor in the house. I have a question for him. I have somebody I've been treating, well, not really treating. He's been using he's been using our product, the Phytoscience product, and he has issue with his leg. You know, talking about muscular pains, like you said, and then he did an X-ray because the leg was really swollen. He got to a point he couldn't walk with it. He could not fold the leg, you know. So he did the X-ray and there was nothing. There was nothing wrong with the bone. But I think the doctor said something like he has to do with his tendon, something like that, you know. So, and then he's been using crystal cell for some time now. The swollen has gone down, but the pain is still there. And then there are times if he probably lie down or he sits down to get up, the leg locks. So what will you advise in that kind of a situation? I don't know.
How long has he been having this?
This just started, say like 2, 3 months ago.
And what has he been using since then?
Okay, there was a drug the doctor prescribed, and I was trying to get him just before now so that I could get the name of the drug. If he takes the drug, it relieves him, but immediately and then he started using crystal cell, which he got relief, and then oh no, before I started using crystal cell, I think he had taken about 3 sachets of the drug. After that time, immediately he stopped. The pains was more intense. So he went back to the doctor. It was like, if this thing is supposed to take care of this pain, it shouldn't be when I stop taking it, the pain is much. Then that means I'm going to be on this for only God knows how. So he now got in touch with me. So I told him, I said, okay, let's leave the drug. Let's use crystal cell. I actually had double stem cell with me, which I sent to him. He was using the double stem cell. It gave him a little relief. Then I was able to get crystal cell, which I now sent some packs to him. And then the crystal cell helped a lot. But even till now, the leg locks at times. And then the swelling has reduced, but at least you could still see that it's swollen. Then recently I got Miracle Intense for him because I used to have knee pains, which I took crystal cell. Then I decided to experiment on the Miracle Intense. It worked for me, so I said okay. I told him about it, got one for him too. So I don't know.
Since he's getting results from this product, I think what quantities does he use? How is he using the crystal cell and double stem cell?
The crystal cell, it takes one in the morning, one at night.
Okay, and he takes it with a lot of water.
A lot of water. He drinks a lot of water.
Okay. And how long has he been taking this particular therapy now? You said he was taking the other
Yes,
medication.
he's done. Yeah, he's done. He's done. I think in 2 months.
2 months.
Yes,
Okay.
he's done two
So
months.
please, I advise him to add Actual Plus. Yes.
Yeah, he recently got Achu Plus. Then another thing I just remember now is if um if he rubs what is it called nerve and bone. If he rubs nerve and bone, is it no, sorry, neurogesic. If he rubs neurogesic on it, it's like it reduces the pain. I don't know, kind of. So I don't really know, but he's still using the crystal cell. It takes Atrio Plus. So
And the Miracle Intense.
yes, he uses the Miracle Intense first. Allow the body to absorb it before using the Neurogesic.
Please let him increase the dose of that Miracle Intense to twice a day, morning and night.
He
Not just
actually does it 3 times, morning, afternoon,
okay.
night.
Oh, it's okay. It's okay. So let him continue to use it that way. Or in addition,
Okay.
let there be Actual Plus and still continue to use this crystal cells and then double stem cell.
Okay.
Let's continue to use them. Yeah, you get
Okay.
good results. Yes. Sometimes you need to take these things for some time too to get the
Yeah.
result. So since he getting some relief when he takes them, let him just continue. It's about rebuilding the cells that are damaged and regenerating new ones. So if you take some time too, but encourage him to continue.
Okay. All right. Thank you so very much. I appreciate it.
You're welcome.
God bless you.
Amen.
All right, thank you, ma'am. Oh my goodness. We're getting more questions, but we have to close. So I was just going to take two more. Or someone sent me a private message. I think he sent it for a while. Let me just quickly take that. It says, I have already ordered for crystal cell for my 85-year-old mom suffering from ovarian cyst. but she's diabetic even before she had the ovarian cyst. So what product do I need for the diabetes?
Okay. She's already taking crystal cells. Is crystal cell the only product she's
Taking
taking?
crystal cell, but she was taking crystal cell towards ovarian cyst. Towards some
Okay.
problem of ovarian cyst. But
Okay.
now the mother is diabetic. And she's been
Please,
diabetic even before they discovered the ovarian cyst, from what I can read here. So she's now asking how does she address the diabetes?
let her include snowfield forts and Aqua Plus. In addition to the, and continue to take the crystal cells, snowfield forts and Aqua Plus.
Okay, so Snowfield Fort Actor Plus. I'm sure the person can hear you. It wants to remain private, so
Okay.
I'm sure you can hear.
Please include that one.
Okay, two more and we'll wrap up. We have G. G, please unmute yourself.
Hello, good evening.
Yeah, good evening.
Yes, I have a cousin that he has alopecia. This is the condition that all the hair in his body just scrape off. This like 4 years ago now, and then we've tried everything, but the hair is not coming back. I just want to ask, what can we give him from this therapies we're talking about, please?
Okay, ma'am. I'm good.
Alopecia, I don't know. Is there anyone that has a testimony on that? Alopecia?
I think I've had one or two, but I can't exactly remember how the testimony was sent. Yeah. I think I've had one or two on alopecia.
A lot. Well, it's a regenerative medicine. What has the person used so far? Nothing?
Nothing. For now, nothing.
Okay.
Because we've been to the hospital. That's 4 years ago. There's nothing they can do. We've tried anything. Nothing.
Okay. Please let's just go and then use crystal cell, use double stem cell, and then use no field fault. Use these three combinations, and then at least for 3 months, and then monitor progress. Yes, please take note of this. It should be used for at least 3 months.
Okay, so crystal cell, double stem cell, and snowfield form.
Yes, take 2 crystal cells in the morning, take 2 double stem cells in the evening, and then snowfield fort should be taken. One sachet daily. Yes.
So crystal cell 2 in the morning.
And then you take the snowfield fort. Take about 2 packs. Take it for a month. Complete 1 month. Yes.
That's snowfield fort for 1 month.
Snowfield crystal cell, double stem cell, and snowfield fort.
Yes.
The dose would be 2 sachets of crystal cells in the morning, 2 sachets of double stem cells in the evening, and then 1 sachet of snowfield fort daily for 1 month.
Okay. All right. Thank you very much.
All right, hold on.
Yes, some people. Yes.
Yeah, Bibi
Madam
has
Anka and Bibi. Yes, you have your hands
Bibi,
raised.
unmute yourself. Yeah, I think people want to share.
Good evening, now.
Yeah.
Good evening, now.
Yeah, good evening.
Well done, Dr. Farm Jude. Well done. Osato, you are doing a great job. And Didi, what can I say? You are just the best at what you do. I want to add, for the case of alopecia, I want to add, I'm trying something out and it's working. In addition, please use Miracle Intense.
Okay.
And I have seen it's on myself because I try things out on myself and I can see improvements. So please try that. Had Miracle Intense. Spray it on the head and let's see. I've tried it for 2 weeks now and I'm seeing a great improvement. So please do.
Okay, this one is all over the body. There's no hair at all in the body at all.
It's not just his head.
No, not just his head. All
Okay,
over his body.
we can try with the head first. Body hair, I don't know how bad that is, but body hair it's okay. But for hair on the head, I think that is more important. Let's try that. Yes.
Okay.
Yes,
Okay,
because it
thank
will
you.
work if it yes, it will. It will work.
Okay.
And follow the pharmacist
Advice, yes.
prescription for use. Yes, it will help.
Okay. Okay.
Thank you. Thank you for
Thank you
allowing
very
me.
much. Yes. Yeah.
Yeah, thank you, baby.
Yeah. Okay. So, Osatu?
Hello.
Who else? I think one more
Yes.
person.
Okay. Madam Anka is raising her hand, but I
Okay.
think Otumba wants to say something quickly. Otumba, so please unmute yourself, sir. We'll come to Madam Anka. Sir, please unmute yourself.
Yes, I'm here. Yeah, I think I've taken the
Okay,
thing.
sir.
It's giving me like 170 over 107.
Wow,
Whoa.
wow,
Wow.
wow,
That's why you have
wow,
the headache.
wow, wow, wow.
Ooh. That's why you have the headache.
Yes,
Okay,
you see,
it's high.
look, you see,
It's high.
please, do you have access to any anti-hypertensive drug now?
No.
Ah, sure. Well, what I will advise you to do now, between now and tomorrow, what product you have? That is quite high, sir.
Yes.
170 over one something. It's high.
107.
Okay. It's an
Okay.
emergency situation.
I think I'll call the NHS now.
Please do.
I'll do that.
Yes, please do. Immediately.
Thank you very much.
Immediately.
Thank you very much. I'll do that now. Thank you.
Okay, sir. You'll be fine. It's just what the pharmacist is trying to do is just to step it down in the immediate because they need to step it down now as much as possible. Then you can now take the product, but you need to step it down first. So you place that call so that you can get something to step it down.
Oh, yeah, it's very important. Please do.
Hello, 41.
Yes. All right. Okay, I think we have to end here. So this is 10:15.
It's 10:15. Yes. Wow. 10 past 10. Wow. Can see Mama Slate in the house. Okay. Yeah. Okay, Didi.
Wow.
Can you
Please
unmute read that now? Okay.
All
okay,
right,
Didi,
so
I've done that.
Yeah,
Princess is in the house. Okay. Okay. Thank you so much from Jude. But we've heard so much today, and honestly, I've learned a lot. There are some key words that I actually took out of this meeting: the phenomenon, regenerative, revolution, repairing and replacing, and all these, go with our products. And you said something about everything that grows, that everything that have life needs to be repaired. And I'm reaching out to everyone today. We have what it takes, and that's our products. Our products are here to help rejuvenate and repair all those cells that have been damaged. Because with this stem cell therapy, we shouldn't live in fear. We shouldn't deprive ourselves of things that God has given us the knowledge to actually acquire from people who were smart enough to look inward to say, what can we do? What can we do by turning away to the natural, going back to plant stem cell? We just thank God that we have this wonderful platform. So I encourage each and every one of us, please, if you're new here, go back to whoever has invited you and look for her to, join and take advantage of this opportunity. Like we all saw at the very beginning during the presentation, our health is in our hand. We shouldn't blame anybody if we don't handle our health very well. At this point, I'll say thank you all. Thank you for spending so much time. And I know it was really worth your while. Thank you for coming. Dr. Farm Jude, thank you so much. And Gigi, thank you. You did an awesome job. Thank you and have a wonderful night, everyone.
Thank you so much, Osato. From Jude, please, special appreciation from me as well. I called on you 99th hour and you made this happen. It's amazing. It's amazing. Thank you so much. You're a huge blessing to us, and together we'll continue to spread this gospel and save more lives as much as possible. We appreciate you. Thank you. And don't forget, Friday is allows us to enjoy certain lifestyle as well. It's nothing extra to what you're doing already. It's just for you to understand that you can translate it from just using the product to also getting benefit in terms of generating income from it. So we'll ask you to join us Friday, 8 p.m. on our business and lifestyle with stem cell, with Phytoscience plant stem cell. Okay, thank you all. I see some people are assisting to answer some questions in the chat room. So if we didn't take your questions this evening, we apologize. We have reached our time. We'd like to stay for 2 hours, and we don't like to extend beyond that. So you can join us again next week, Tuesday, and perhaps we'll be able to accommodate your question if it's not being answered today. Okay, thank you, everyone. At this point, I think we should unmute.